Manipulations help. They help with pain, they help to reduce pain. They are not a panacea. They don't put Jones' bones back into position. A lot of what he was doing with the drop table, with the Theragun, a lot of this stuff is smoke and mirrors. It's just doing stuff because it looks good and you're playing on that placebo effect. Okay guys, so in this video we're going to react to a spinal adjustment video, and it's just a really good opportunity to go through some teaching points. Let's get into it.
Okay.
So now, like you're telling me, from New York, just moved to North Carolina.
Just relocated to North Carolina. Been a foreman for a cold refrigeration company for 8 years. Just recently left it to relocate.
Mm-hmm.
Only been down here for about a month.
Okay.
It's about a little bit more than a month. It's just been getting worse and worse, but it doesn't stop me. But I have to get this situation fixed. It's been a long time, and it's affecting everything. It's affecting myself. It's affecting.
Okay, so first thing that we need to talk about, he listens to his story. One of the things we know about pain, about dysfunction, about injuries is that people and patients want to be heard. They want to have their story listened to. He doesn't interrupt him a single time. He lets him tell his story. And I think that's one thing I would say straight away he does really well. Most people will talk for less than 2 minutes when you do this, and it gives you such a lot of information when you ask people to just tell them, about yourself. Another thing I will say though is you look at the background in his room, a big Dr. Joseph Cipriano on the wall. So he's coming across like a massive specialist. And I think one of the things we have to realise with placebo and with lots of things, whether it be this, like putting your name on and making it out to make yourself look like a kind of a big dog basically, or things like surgery, injections, all these things have a perceived value, and patients who perceive something to be more specialist often have better results from that. So there's a huge psychological effect. Not only that, but obviously this guy is a big guy on YouTube. He's got millions of followers on YouTube. So when patients go and see him, they are going to see in their minds what they perceive to be a huge expert. And so that is going to cloud what happens in their treatment. They are going to get better outcomes than if they went to a chiro down the road, because this guy is seen to be the expert.
I want to go through some ranges of motion. I want you to bend forward for me at the waist. What do you feel when you do that?
Tightness.
Tightness?
I feel tightness back of the thighs, back of the knees, here, and you feel like a little back of the neck.
Gotcha. Yeah, all through here. And now,
again, same thing when he's doing his range of motion. He's asking him how it feels. He's basically validating. He's listening to the person. He's making it the patient feel like he is the center of his attention, like he is really wants to understand his pain, and that's really good. Also, the subtleties of touch. Straight away he goes in, he starts touching him, he starts putting his hands on. Again, the therapeutic value of touch cannot be underestimated. Patients want to be touched, they want you to feel them, they want you to do things. And so I don't think you can underestimate how important just these sort of subtle bits of touching that he's doing with the patient actually are for making him better, much more so than some of the manipulation, which we'll go through in a sec. Okay, so just a quick point here. I don't know what the patient's been through before he has been into this session, before it's been filmed, so I don't know whether he's filled out forms and stuff before he's gone in, but he's basically looked at a bit of range of motion. He's kind of asked him how he's doing. He hasn't really gone through any medical history. He hasn't really gone through any of the red flags for back pain. So straight away, if you're going to do manipulation, you need to be asking about their cardiovascular health. You need to be asking about their bone health in particular. So osteoporosis, metabolic conditions can affect the bone, previous long-standing alcohol abuse, drug abuse, things of that nature. You need to go through a full subjective, because if you just turn around and start high velocity thrusting patients who have poor bone health, then you are risking doing something dangerous. So we know that contraindications to manipulation are those kind of things that will affect bone health. So really important that you go through that. Again, I don't know whether he's been through that before with this guy. It's very possible that he has, but really important that you understand that you would need to go through that with the patient, and really important just to make yourself covered, keep yourself covered as well.
and when checking the leg length here, Yeah, if you want to come in, you can see. So that right side pulls short compared to the left side.
Okay, leg length is a massive bugbear of mine. Number one, he's in fully clothed, so you really can't tell what position his feet are in just because his foot looks slightly shorter. It could be something, you know, spinally. He could have a scoliosis. He could be slightly different in his hip positions. Plus, we know that the evidence suggests that leg length doesn't really matter anyway. So, you know, unless you've got a significant leg length discrepancy, leg length is not something you really need to worry about. People get so obsessed with leg length and say, oh, my leg's longer than the other, that's why I've got my pain. No, it isn't. Stop thinking that leg length discrepancy is a problem. It's only a problem in very few cases, and it's a myth and misconception that needs to stop now. Okay, massage guns. Everyone loves them because they look cool and they make a good sound and they're impressive to look at. But you know, how good are they really? I think it's, yeah, maybe you're getting some neurophysiological effects. Maybe you're getting a bit of very short-term relaxation. But the benefits you get from these things is so short-term. I think that people buy and thinking they're the magic panacea, and they're definitely not in most cases. So yeah, I think again it's smoke and mirrors. So similar thing to the name on the wall, it's using tech, people like it, they think it's going to be doing them some good, and therefore they feel better after having used it.
I'm going to bring this headpiece a little down for you. There we go. Good.
I love this, like, does this manipulation and he's like, good. And it's just again, it's smoke and mirrors. It's him saying stuff that he knows will get a reaction from the patient. It's like, I've manipulated you, good. One of the things that evidence-wise we know is that actually when you compare manipulation with cavitation, so that's the cracking noise, to non-cavitations, there's no difference in outcomes. So you can do a manipulation, if it sounds, if you get the sound, then it doesn't really make a massive difference. I think that again there's a placebo effect with the sound, so people like to hear the sound, so I think sometimes people can feel that better when they do that, but the evidence doesn't really seem to suggest that there's a lot of difference between the two. And the other thing as well, with a lot of manipulation, I think throughout this video you'll see him do various manipulations and you just think, yeah, they can help with short-term pain, but none of it's realigning bones. We know that it's not going to realign his thoracic spine. So if you MRI'd his spine now and you MRI'd his spine after having these manipulations done, it would be exactly the same. The studies have been done, the MRIs, the functional MRIs have been performed on patients before and after manipulations, and there is no change in bony alignment, and I'll put the links to those studies in this video. There aren't any physical differences. It does change pain, so it does help, and it does, and we'll talk about this as we go through. Manipulation is certainly something that I use from time to time with patients. I think it can be used in combination with lots of other things, but it's certainly not a realigning of positions. You're not realigning the pelvis, you're not realigning joints. So again, when he's talking about reducing his thoracic kyphosis, he's not going to do that with manipulations.
Okay.
And oh man, this drop table just drives me mad. Like, what is this drop table? I don't understand it. You guys in the comments below, leave me some messages. What does a drop table do over and above normal manipulation? I really don't know any research papers or evidence that suggests that this is better than normal manipulation. I don't know why you would do it. Let me know in the comments, but to me, this is again, massive smoke and mirrors. He's just doing it because it seems cool, it makes a noise, and so the patient is then more impressed by it, and that's all it is in my view.
Cross your right foot over your left foot. Yep.
drop table, again, driving me mad. Like, what? All he's doing with that drop table is getting his pelvis moving, and basically you could get a lot of these effects you can get with loads of other manual techniques. He's just doing a lot of stuff where he's moving around, he's doing things where he's causing a neurophysiological effect. So he's basically causing pain inhibition around those areas, reducing down stiffness, reducing down pain, so that basically he can move better, and he's going to move better. Like I have countless patients who come in and you do some manual stuff and they move a bit better afterwards, but it's the long-term pain reduction that you need to go through with people. So if you're only doing these manual techniques and the patients believe that they need these techniques to improve long-term, then often they're not going to get better long-term. And so you need to teach patients and basically make them understand pain and educate them about pain in a effective way that means they can get some relief long-term, which I don't think this stuff does. I mean, this is the other thing. He does not look comfortable. He looks in so much pain getting it done, and it's like he thinks he needs to go through this pain in order to have it, like, make it better, and he thinks he needs manipulation to make this better, and he doesn't. Like, there's plenty of other treatments that I think this guy will end up having. I don't think this is the first time he'll be at the chiros. I don't think it'll be the last, and he'll probably end up in 5 to 10 years time realizing that chiro and manual therapy alone isn't going to help, and he needs to go down another route and manage his pain and learn to live with pain in a different way. And yeah, I just think he doesn't need to go through all this pain for very limited gain.
Yeah, so these are going to be kind of lighter in the beginning. I want to get a good stretch here.
Again, I just think that it's not necessary to use this strap in order to get a manipulation of the spine. If you want to manipulate the cervical spine, fine, and there's benefits of that doing that, but I don't think you need to use a strap and use that much force in order to do that. The risks just outweigh the rewards in my mind. Again, drop table, please someone tell me what it's for. Genuinely, like, it just baffles me.
Yeah, from the first time when you laid on your back there, after that first Y strap, it went from...
He's giving it a thumbs up, but he doesn't look any different to me. Like, he looks still the same. Again, like, I want this guy to feel better. Like, I hope he does feel better, but ultimately, he's just been moved around. He's moved his body and he feels good because he's moved around. There's no magic being done there. You can see from his position that he isn't massively changed. Manipulation does not change your positioning. We know that from the studies. It doesn't put you back into alignment. It doesn't do anything special. It just helps to reduce pain. In some patients, that can be a good thing in the short term. But someone like this with a really long history, I can guarantee you this is not going to be the first time or the last time he's at this guy's office, and he'll get fleeced. I've seen it so many times. People come in and they're like, been to the chiro for 20 years and I go all the time and it's no better. And it's just like, I think that there's a good way to do this sort of thing, and there's in my mind, not a good way. And yeah, this isn't great in my view.
I want to try to do in about 2 weeks from now. Okay. And then we'll do every 2 weeks for about a month or 2 months, and then I want to take it back. Typically the goal is about 4 times a year. Okay.
Again, why 4 times a year and why this schedule? It should be come back in however long, 2 weeks is fine, but you come back in until you are better, until you feel like you can manage your pain, until your back pain until you've helped that person to manage their pain. You don't need someone on this repeat business basis. It's just absolute bollocks. Like, I don't agree with this whole, you just treat someone for 4 times a year, every single year, for no reason, because it's just fleecing people for their money. And ultimately, you should be there trying to give people the tools and the resilience to cope with pain on their own in the long term, to not have to rely on healthcare professionals. I want people to see me as a physio and never see me again. I want them to have the tools and have the knowledge and have the understanding of pain to be able to cope with it on their own. Now, they're not all going to be able to do that because pain is so complex, but giving people this expectation of you're going to need to come in this many times over the next this many weeks, without any real justification for why that is, or without any kind of saying, you know, it's definitely going to be better than this time, and you don't know how long it's going to take. So I just think that, again, it's another thing, a real bugbear, where people say, well, you need to come in 4 times a year for forever. Well, why? Why do you? Okay, so I want to sum up. So look, I am not against by any means chiropractors. I think that a lot of them do a great job. I'm sure he has had some amazing results with lots and lots of people. And by that, I mean reduction in pain. A lot of people, maybe they haven't had the care they should have had. He listened really well to his story, so he validated him. He touched him, he palpated him, he kind of gave him the impression he knew what he was doing, that he was in safe hands. He's a celebrity on YouTube. There's a huge placebo factor there. There's huge this expert factor. The guy obviously was very, very impressed with him. He obviously was very happy to come and see him. So look, there are manipulations help. They help with pain, they help to reduce pain. They are not a panacea. They don't put Jones' bones back into position. A lot of what he was doing with the drop table, with the Theragun, a lot of this stuff is smoke and mirrors. It's just doing stuff because it looks good, and you're playing on that placebo effect. You know, a lot of what he could have gone in there and in the space of 5 minutes done a lot of those manipulations and got exactly the same benefit. A lot of the manipulations with the Y strap, I just don't think you need to put that much force through. I think you could get a lot of the same benefits with very, very minimal or limited more treatment. And I think the problem with these things often, for me, is that they breed this reliance on healthcare. They breed this opinion that people need to go and see guys like this or these experts in order to get better. We know that the evidence doesn't suggest that. It doesn't suggest that manipulation does anything special. It can reduce pain. It's always in the short term, and it can be useful, but as an adjunct to other things. People need to understand what causes pain, how to manage pain, and often how to be more resilient to pain. So I think, you know, there's a lot in there to unpack, but ultimately there was things in there that really concerned me. He's obviously, you know, he's knowledgeable with regards to the manipulations and does them very well, but I just don't think a lot of it was very you know, moral, if I'm being totally honest. And I think that a lot of people that go and see him, who get these amazing results and the before and afters, a lot of these people, you look at them in 10 to 15 years time and they're actually probably going to be in a worse position than they're in now. Hopefully you enjoyed that, guys. It's a little bit of a different one today. Leave your comments in the comment section below about what you think. Again, like I said, probably going to get loads of hate comments about this, but I'm not against chiros at all. I've worked with osteos, I've worked with chiros who are absolutely amazing. They use their manual therapy alongside exercise, alongside pain management strategies, alongside all the good things that a good therapist will do. But I think you just do have to be very careful with the patients you choose for these sorts of treatments and who you pick, because the reliance on healthcare is a real issue. So yeah, leave your comments in the section below, like and subscribe to the channel if you're new here, and I look forward to seeing you again next time.